If you're a man over 60 and you've noticed that sometimes you reach the peak of intimacy without actually seeing any semen come out, I want you to stop what you're doing and listen to me for a few minutes. I'm Dr. Claire Weston, and in my 20-plus years practicing urology here in the States, I've sat across from hundreds of men who walked into my office carrying this exact worry. Some of them whispered it like it was a dirty secret. Others teared up right there in the chair. A few admitted they'd been avoiding their wives for months because they were terrified she'd notice something was off. So let me say this loud and clear right up front. You are not alone, and this does not mean you've lost your manhood. What your body is showing you is a change. It's a signal worth paying attention to, but it is very rarely the disaster men fear it is. Sexual health is health, plain and simple, just like your heart or your blood pressure. Something that feels shameful in the bedroom almost always has a straightforward medical explanation, and in most cases, a fix that's simpler than you'd think. I know this topic hits hard because it goes straight to how a man sees himself, but trust me on this one. Understanding what's happening is the first step toward getting your confidence back. I've watched guys walk out of my office 10 pounds lighter emotionally just from finally knowing what was going on down there. Today we're going to walk through this together. What dry orgasm actually is, the most common reasons it happens, the warning signs that mean you need to pick up the phone and call your doctor today, and the real options you have in 2026 to get this sorted out. Stick with me because talking about this openly is the best thing you can do for yourself and your relationship. Before we get into what goes wrong, let me quickly explain what's supposed to happen. Semen is made up of 3 main ingredients. The sperm themselves from your testicles are actually a tiny fraction, only about 1% of the total volume. Most of the fluid comes from 2 little glands called the seminal vesicles, which produce a sugar-rich liquid that gives sperm their energy, and the prostate chips in too, adding a fluid packed with enzymes and minerals. When climax hits, all of this meets up in the urethra like tributaries flowing into a river, and the pelvic muscles contract rhythmically to push it all out. Nerves and muscles work together like a well-rehearsed orchestra. When something throws that coordination off, the orgasm can still feel the same, but the fluid just doesn't show up. That's when the worry starts. A dry orgasm is exactly what it sounds like. You reach climax, you feel the same pleasure you always have, but there's no visible semen afterward. On paper, it sounds like a small thing, but if it's happening to you, I know it feels like a big deal. A lot of my patients describe it as feeling like their body is emptying out on the inside, but nothing's coming out. That's a real and valid way to describe it. Here's something important most guys don't realize. Orgasm and ejaculation are 2 different things. They almost always happen together, which is why we think of them as the same event. But the orgasm is the neurological response, the rush of pleasure. Ejaculation is the physical act of releasing semen. When the first happens without the second, that's when the confusion sets in. Men tell me they feel a mix of emotions, relief that the desire and the erection are still there, but anxiety because the visible proof of their masculinity is missing. That contrast breeds silence, and silence breeds shame. Now here's the good news. A dry orgasm is not automatically a sign of serious illness, but it is a signal that deserves a real answer. So let's go through the most common reasons this happens, one by one. The first and most common cause is something called retrograde ejaculation. Normally, when you reach climax, the bladder neck closes up tight like a gate, so semen can only travel forward through the urethra and out. In retrograde ejaculation, that gate doesn't close all the way. The semen takes the path of least resistance and heads backward into the bladder instead. You feel the orgasm just like always, but there's nothing to see. Then when you urinate afterward, you might notice your urine looks cloudy because the semen is mixed in with it. Why does this happen? A bunch of reasons, actually. One of the biggest is prostate surgery. Procedures like TURP, which is that transurethral resection we do for enlarged prostates, are common as men get older, and they can affect the nerves that control that bladder gate. Certain medications can do it too, especially some blood pressure pills, older tricyclic antidepressants, and the alpha blockers we prescribe for prostate symptoms, like tamsulosin, brand name Flomax. Neurological issues matter as well. Poorly controlled diabetes, multiple sclerosis, spinal cord injuries, All of these can scramble the nerve signals that coordinate ejaculation. Even pelvic radiation for cancer treatment can leave scar tissue that changes the plumbing. Diagnosis is actually pretty simple. We do a urine test right after orgasm and look for sperm in the urine. If they're there, we have our answer. When retrograde ejaculation is caused by surgery, it can be permanent. But I want you to hear me on this. It does not take away your pleasure, and it does not take away your manhood. If fertility is a concern, reproductive medicine has come a long way. We can actually retrieve sperm straight from the urine or directly from the testicle for couples trying to conceive. I remember a patient I'll call Frank, 58 years old, a retired firefighter from Pittsburgh. He came in about 6 months after laser prostate surgery and told me his orgasms were totally dry. Nobody had warned him this could happen. When I explained that his performance and his masculinity were completely intact and that the semen was just taking a different route, I watched his shoulders drop 3 inches. He said, "Doc, I thought I was done." He wasn't, not even close. The second big cause is blockage of the seminal vesicles. Remember those 2 little glands I mentioned? They produce somewhere between 60 and 70% of the total volume of semen. Their fluid is loaded with fructose and nutrients that keep sperm alive and moving. When those glands work right, everything flows smoothly. When they get blocked or inflamed, the volume drops off a cliff, sometimes disappearing entirely. The reasons for blockage are varied. Old infections are a common one, especially untreated prostatitis or repeated UTIs that leave scar tissue in the ejaculatory ducts. There are also seminal calculi, tiny stones similar to kidney stones that can partially or completely block the channel. In some cases, we find congenital cysts, things you were born with that stayed quiet until middle age. Pelvic trauma from a bad fall, a car accident, or certain surgeries can also narrow or close off the ducts. The symptoms can give us clues: painful orgasm deep in the pelvis, thicker or clumpy semen, dramatically low volume, or unexplained infertility. To confirm, we use tools like a transrectal ultrasound, which lets us look right at the vesicles and spot cysts or inflammation. A semen analysis tells us a lot too, like low volume, absence of fructose, or abnormal pH. For the tougher cases, we'll order an MRI to get a clearer picture. I had a patient a while back, a guy in his mid-40s from outside Denver, who came in with his wife after they'd been trying to have a baby for 3 years with no luck. His erections were fine, his desire was fine, but he noticed his semen volume had been shrinking for a while. We found an obstructive cyst on one of his seminal vesicles. A minimally invasive endoscopic procedure cleared it out, and 3 months later I got a card in the mail saying his wife was expecting. Stories like that are why I do this job. The good news is these problems have solutions. Treatment ranges from long courses of antibiotics for chronic infections to endoscopic surgery to remove stones or cysts. There are even ultrasound-guided aspiration techniques for certain cases. Recovery is usually quick and the results are typically really good. The third major cause is hormonal, specifically low testosterone. This hormone, made mostly in your testicles, is the engine that drives sperm production and keeps the prostate and seminal vesicles working right. When your levels are where they should be, your body responds with energy, desire, and healthy semen production. When testosterone drops significantly, the whole system starts to stall out. In the early stages, you might notice your semen looks more watery or there's just less of it. Then comes lower libido, softer erections, less intense orgasms, or even dry ones. On top of that, you get the full low T picture, chronic fatigue, losing muscle, gaining belly fat, and trouble sleeping. A lot of men chalk this up to just getting older, but it's not something you have to just accept. It's a real treatable condition. Diagnosis starts with a hormone panel: total and free testosterone, LH, FSH, prolactin, and thyroid. We want to draw the blood in the morning when testosterone is naturally highest. Anything under about 300 nanograms per deciliter generally counts as low, but we always read that number in the context of how you're actually feeling. There are 2 types of low T: primary, where the testicles themselves aren't responding, and secondary, where the pituitary gland isn't sending the right signals. Treatment depends on which one you have. Testosterone replacement therapy, whether injections, gels, or patches, can bring back your energy, muscle, and semen volume. But here's a heads up. TRT is not a great choice if you're still hoping to have kids, because it can actually shut down your sperm production. For those guys, we use medications like HCG or clomiphene that tell the body to make its own testosterone. I'll tell you about another patient, a guy in his early 60s from right outside Chicago. He came in exhausted, worried about dry orgasms, and convinced he was just falling apart. His labs showed secondary hypogonadism. We started him on a stimulating medication, and within a few months he had his energy back, his confidence back, and, in his words, his marriage back. Now I have to get serious with you for a minute, because there are some situations where dry orgasm is more than just an inconvenience. It's a warning sign, and you need to know what those look like. The first red flag is when the semen disappears suddenly, out of nowhere, with no recent surgery and no new medications to explain it. The body rarely changes overnight. When it does, it's telling you something serious is going on, and you need to be seen right away. Another one, when dry orgasm shows up alongside other symptoms. Pain during orgasm, blood in your urine or semen, loss of sensation in the genital area, or a sudden drop in desire. These together can point to infection, neurological disease, or in some cases, something like a tumor that needs urgent attention. A third situation is for younger men still hoping to start a family. Dry orgasm is a direct obstacle to natural conception. Assisted reproduction has some amazing options today, but wasting months or years before seeing a specialist can delay the dream of having kids. And I have to mention this because I won't be doing my job if I don't. Sometimes dry ejaculation can be the first visible sign of prostate, bladder, or testicular cancer. As those tumors grow, they can press on the ejaculatory ducts and block semen from coming out. So if you're seeing dry orgasm along with trouble urinating, pelvic pain, or any bleeding, that is not something to brush off. That's a call your doctor this week situation. Bottom line, dry ejaculation is often benign, but when it shows up suddenly, with pain, with blood, with loss of sensation, or with fertility problems, it's your body flagging you. Listening to that signal and calling a urologist on time can be the difference between an easy fix and a much bigger problem. Now let's talk about something I don't think gets enough attention: the emotional side. When an older man runs into dry orgasm, the hit isn't just physical. The emotional piece is usually just as heavy, sometimes heavier. I've had patients walk into my office in tears, not from physical pain, but from the weight of months of silence and shame. The absence of visible semen, even when the pleasure is completely intact, stirs up all these questions about masculinity. A lot of guys read this change as a sign of weakness or lost virility. And that belief, more than the change itself, is what eats away at self-esteem and confidence and changes how you show up with your partner. In the bedroom, partners often notice the difference and don't always know what to make of it. Some read it as a lack of desire or lack of effort. Misunderstandings build up. The man, afraid of disappointing, starts dodging intimacy. The partner, with no real explanation, starts feeling rejected. Both people suffer quietly over something that actually has a real medical answer. I think about a gentleman I'll call Henry, 67, retired teacher from somewhere in New England. He told me he'd spent months avoiding his wife because he was afraid she'd notice the dry orgasms. Their marriage had gone cold. They were living like roommates. When he finally came in and we figured out that it was a complication of his diabetes, not a failure of his manhood, something shifted in him. He got the confidence back. And with it, he got his marriage back. That's why I keep saying it. Talking about this breaks the cycle of fear and isolation. Dealing with the emotional impact is every bit as important as treating the physical cause. Intimate health is also emotional and relational health. Don't let silence run your marriage. All right, let's talk solutions, because that's what you really want to know. The good news is that in most cases of dry ejaculation, there's something we can do. Treatment always depends on the cause, which is why the first step is getting a clear diagnosis from a urologist. Please don't self-diagnose from the internet. When a medication is the culprit, often the fix is just adjusting the dose or switching to a different drug, under medical supervision, of course. I've had patients get their normal ejaculation back just by swapping one blood pressure pill for another. No surgery, no drama, just a prescription change. For retrograde ejaculation, there are medications that can help tighten up the bladder neck and encourage forward flow. Results vary, but but for some patients, they make a real difference. If the retrograde is from surgery, it may be permanent, but remember, the pleasure stays intact. For seminal vesicle obstruction, antibiotics or anti-inflammatories can help when the cause is infection. When there are stones or cysts, minimally invasive endoscopic surgery can clear the channels and restore flow. These procedures usually have quick recovery times and solid results. On the hormonal side, TRT can improve energy, desire, and semen volume. For men still wanting kids, we lean on treatments that stimulate natural testosterone and sperm production, like HCG or clomiphene. And when fertility is the main goal, reproductive medicine has advanced techniques to retrieve sperm from urine or directly from the testicle. In every single one of these scenarios, the message is the same. Don't resign yourself to this. There are always options, from simple tweaks to specialized treatments. The essential move is picking up the phone and getting seen. Beyond the medical treatments, there are everyday things that make a big difference in your intimate health. Real talk, this is the stuff I tell every patient. First, don't keep this to yourself. Talking to your doctor is the most valuable step you can take because every case is different and deserves a personalized plan. Second, stay on top of your chronic conditions. If you have diabetes, high blood pressure, or any neurological issues, keeping them well controlled is huge for protecting sexual function. I've seen guys whose symptoms dramatically improve just from getting their A1C down. Third, lifestyle matters more than most men realize. A balanced diet loaded with fruits, veggies, and fish, think Mediterranean style, cuts down inflammation and supports hormone production. Regular exercise, even just a 30-minute walk around the neighborhood every day, improves circulation and energy. And sleep, please don't underestimate it. Good sleep regulates hormones and strengthens the nervous system. A lot of guys I see are running on 6 hours a night and wondering why everything feels off. Another one, and this is a big one, don't self-medicate. I can't tell you how many men come in with a cabinet full of supplements they ordered online that are interfering with their actual medications. Always check with your doctor before adding anything new, even the stuff that looks natural. Finally, remember this. Sexuality does not end at 60 or 70 or 80. With the right information and the right care, you can keep enjoying a full, satisfying, intimate life. Before I wrap up, I want to answer a question a lot of you have been leaving in the comments. What foods actually help with circulation down there? I hear you, and I promise I'm working on a dedicated video for that, breaking down the specific fruits and foods that support blood flow and nitric oxide production, which are the real drivers of erection quality. So if that's what brought you here, hit that subscribe button so you don't miss it when it drops. As we come to the end of this, here's what I want you to walk away with. Dry ejaculation is not a trivial detail. It can be the result of surgery, medication, a hormonal shift, or a blockage. And sometimes, though not usually, it's a sign of something more serious. That's why it always deserves attention. But here's the message I really want you to take home. It does not mean you've lost your masculinity. Having orgasms without semen does not take away your pleasure or your worth as a man. What's changed is a physiological mechanism, and in most cases, there's an explanation, and often a solution. I've seen men get their peace of mind back just from understanding what was happening. Knowing their virility was still intact gave them back their confidence and their intimate life. That same relief can be yours too. The most important thing is not to stay silent and not to just accept it. Seeing a specialist opens the door to treatments that are often simpler than you'd expect and catches things before they become bigger problems. Sometimes it's as easy as tweaking a medication, getting a chronic condition under better control, or starting hormone therapy. Silence is the enemy here. Listen to your body, because it doesn't speak up for no reason. If this was helpful, leave me a comment and let me know your story, or the question you wish someone would finally answer. I read these, and I use them to plan future videos. Share this with a friend or family member who needs to hear it, because somebody in your life is quietly going through this right now. And if you're new here, hit subscribe so we can keep having these conversations. The real ones about the parts of men's health nobody else is talking about. I'll see you in the next one.